You need to go get changed for attending rounds.
Oh, yeah.
And don't be late.
Right, okay.
You must be Richard. I'm your attending, Dr. Toto.
How do you do?
You missed most of your colleague's excellent presentation. Please continue, Becker. Sorry for the interruption.
That's okay, Dr. Toto. I'm sure Richard has an excellent reason for being late. In summary, this is a 44-year-old Hispanic female with sharp, non-radiating flank pain of 3 days duration. Her heart rate's been in the high 90s since admission, although the rest of her vital signs have been within normal limits. On physical exam, she's not stressed, has a left lower quadrant abdominal tenderness without costal-vertebral or cervical motion tenderness. On laboratory examination, she has a negative urine HCG, a mild anemia, and a leukocytosis without left shift. The differential diagnosis for this perimenopausal woman with flank pain and a constellation of nonspecific findings includes appendicitis, gastritis, nephrolithiasis, urinary tract infection, ovarian pathology, and perhaps a left lower lobe pneumonia. A less likely diagnosis would include pancreatitis, pyelonephritis, GI malignancy, endometriosis, perhaps a irritable bowel syndrome.
Thank you, Becker. Richard, I understand you did a pelvic exam on our patient with chest pain. Seeing as how you're so enthusiastic about obstetrics, how do you know that patient wasn't pregnant?
Her urine HCG was negative.
Does an HCG in the urine always rule out pregnancy?
I guess not.
You guess not. In almost every case, a urine HCG does rule out pregnancy. I have an intern-level question. When does a urine HCG test not rule out pregnancy?
Very early in pregnancy, when the embryonic trophoblasts haven't made enough hormone to be detectable in urine.
Correct. Richard, if this patient was HCG positive, how would that change our management? Becker.
In a pregnant patient with flank abdominal pelvic pain, you have to consider ectopic pregnancy.
Richard, what is the triad of ectopic pregnancy?
The triad of ectopic pregnancy?
Becker.
Vaginal bleeding, abdominal pain, and an adnexal mass in a sexually active patient?
Richard, what is the most common site of ectopic pregnancy?
The fallopian tubes?
Yes, Richard, the fallopian tubes. Which part of the fallopian tube?
I have no idea.
Becker?
The ampulla.
Richard, please show us your penis. Your performance disappoints us. You're gonna have to do a lot better than that. An extrauterine gestational sac is one of the most important obstetric complications, and the astute clinician must be able to both recognize and manage an evolving ectopic pregnancy. In any female of reproductive age, with a presenting complaint between the chest and the knees, the most important test is the qualitative urine pregnancy test. In the setting of a positive urine HCG, the patient's vital signs and general appearance must be assessed for stability. If she is unstable, it is presumed the tube has ruptured and must be managed surgically.
Did I miss anything?
Nothing at all. How was morning report?
Eventful as always.